In fluid mechanics, we have learned about flow in pipes. In our body, there is also blood flow that have a bit same application like the flow in pipe. Our project is about bioengineering application that use in blood flow. We choose a medical procedure called coronary angioplasty. The problem from this procedure is there are cholesterol being stuck to the wall of the arteries. The objective of this procedure is to improve and solve many problems regarding blood flow to the heart, open the blockage in the blood vessels, and restore blood flow through the artery, and may also reduce the percentage of death.
Coronary angioplasty is a technique used to enlarge or narrow the coronary arteries. The word angioplasty means the use of a balloon to expand a narrow or blocked artery. The combination of coronary angioplasty and stenting is normally referred to as the percutaneous coronary intervention, which is PCI. Nowadays, angioplasty procedures often include putting a small wire mesh tube called a stent into the artery during the operation. The stent is permanently left in place to allow blood to circulate more freely. But there is side effect of coronary angioplasty. This is the side effects of coronary angioplasty. Thank you.
So for the procedure, first, when the blockage is identified, the doctor will put a long, thin and flexible tube called a catheter and slides it over the guide wire to the heart. A tube with a small deflated balloon inside it will be slid through the catheter and into the coronary artery where the blockage occurs. When the tube reaches the blockage, the balloon will be inflated. Then, the balloon will push the plug against the wall of the artery and widens it to increase the blood flow to the heart. Then, the balloon is then deflated and the tube and balloon are removed. For coronary stent angioplasty, another tube with a balloon will be threaded through the artery. A stent will be wrapped around the balloon. Then the balloon will be inflated, which will cause the stent to expand against the wall of the artery. The balloon is then deflated, and then it is being pulled out of the artery with the tube, but the stent stays in the artery.
Hi guys, my name is Nurul Syafiqah binti Fauzi. Today I would like to share about the risk of the coronary angioplasty and stenting procedure. Angioplasty and stenting procedure has saved many lives. It is an efficient way to get the blood flowing to the heart again quickly. However, all medical procedures come with certain amount of risk. Although angioplasty is less invasive way to open clogged arteries than bypass surgery is, the procedure still carries some risk. The most common angioplasty risk is blood clot. Even after the operation, blood clot may form inside stent. The entry may be closed by such clot that will triggering a heart attack. And second, the most common risk is renoring the artery. There is a small risk that perhaps the treated artery may be again become clogged when angioplasty is combined with drug eluting stent placement. And third, bleeding. Bleeding also can occur in the patient's leg or arm where the catheter has been inserted. This usually simply results in a bruise, but extreme bleeding often occur and may require blood transfusion or attack during the procedure. The artery may be torn or rupture, and also the kidney problem. The dye used during angioplasty and the stent placement can cause the kidney damage, especially in people who already have kidney problem.
Next is discussion about recovery time. So first is the lifestyle change is to prevent or decrease high blood pressure and high blood cholesterol, and to maintain a healthy weight and follow a healthy diet. If overweight and obese, lose some weight and take medication as directed by the doctor to reduce high blood pressure or high blood cholesterol, and also quit smoking. For the second is cardiac rehabilitation. It involves controlled physical exercise, safe living with heart education and therapy to relieve stress and help the patient to return to an active life. And the last list is going home. After 1 or 2 days of the procedure, most people will go home. They will receive instruction to follow at home if their doctors feels that they are ready to leave the hospital.
For the conclusion, many bioengineering applications have been invented to be used in the medical field and engineering field. One of them is this coronary angioplasty procedure. By using this procedure in humans, it can save many lives and help to lower the risk of getting heart attack and death. This is one of the methods that we can use to improve blood flow in the human body. That's all from us. Thank you.